Everybody experiences fatigue from time to time. Chronic fatigue syndrome is much different. Hi there, I'm Dr. Michael Kaye. I'm the owner of the Center for Functional Health, and today I want to talk about the often debilitating chronic fatigue syndrome symptoms and risk factors so that you can do your best to avoid it. The most obvious symptom of this disorder is fatigue. Not moderate fatigue, but severe enough to interfere with daily life. For a diagnosis of chronic fatigue syndrome, patients must show a significantly reduced capacity to complete normal tasks due to fatigue, which has not improved upon rest. People with chronic fatigue syndrome experience extreme tiredness, especially after physical or mental activities. Additional physical symptoms of chronic fatigue syndrome are muscle pain, large or swollen lymph nodes, frequent headaches, joint pain, and inflammation. Now, while researchers are still trying to uncover a root cause, there are certain factors that can be identified. Chronic fatigue syndrome is most frequently diagnosed amongst people in their 40s and 50s. Women are 2 to 4 more times more likely to experience chronic fatigue syndrome than men. Chronic fatigue syndrome has been seen in members of the same family. And studies done in twins suggest that both genes and environments may play a role in chronic fatigue syndrome, although more research is needed. Now, patients with chronic fatigue syndrome often report that it began following a period of extreme or emotional physical stress or after surgery. This stress actually affects the hypothalamic pituitary adrenal axis, the HPA axis, which controls our body's reaction to stress and regulates a lot of our body processes such as the immune response, digestion, energy usage, and mood. Now, some researchers believe that chronic fatigue syndrome can be caused by a person's immune system and the way it responds to stress or infection. Chronic fatigue syndrome does share some features of autoimmune illness in which the immune system attacks the healthy tissues in one's own body. A growing body of research suggests that celiac disease and food sensitivities or food allergies can be a cause of chronic fatigue syndrome. In many studies of chronic fatigue syndrome patients, almost all of them report problems with digestion. Some of these risk factors also include age and sex and are unavoidable, but no matter your demographic, you can still work to support your healthy immune system by lowering your stress levels and eating a balanced diet to improve digestion. Now, can diet play a role in chronic fatigue syndrome? Surely, I definitely believe that diet can play a role. So the one method of treating chronic fatigue syndrome is looking at what one eats, their diet. Since there appears to be a link between digestive issues and chronic fatigue syndrome, it's important to eliminate potential food sensitivities, allergens, and intolerances that may be inflaming the body and leading to fatigue. If any nutritional deficiencies are found, dietary changes or supplementation may be recommended by a healthcare professional. Now, one can start by reducing the intake of refined sugars, carbohydrates, alcohol, caffeine, saturated fats. Instead, enjoy protein foods, vegetables, some grains, legumes. Eating a healthy diet is really important to improve your overall energy levels. Also, like a candida cleanse diet may be helpful in treating some chronic fatigue syndrome because research shows that overgrowth of candida and the bacteria H. pylori contributes to chronic fatigue. Working with a healthcare practitioner to rule out any potential bacterial imbalance is recommended. There are many vitamins and minerals linked to energy levels that may be helpful in supporting chronic fatigue syndrome. Of course, not all supplements are right for every patient, so you want to be sure to speak with a health practitioner before starting any of the following. At my clinic, before I make any vitamin or supplement recommendation, I always take a thorough case history and order blood work. One of the vitamins that I assess for is B12. Vitamin B12 has been shown to improve energy in people who are deficient. It is a clinical nutrient that supports the methylation cycle, so basically responsible for immune function, energy production, and mood. And all this can help to stimulate your energy and give you better mood and better cognitive function. Omega-3 fatty acids, such as those found in fish oil, may also help to reduce fatigue. Studies have shown that people with chronic fatigue syndrome have lower levels of omega-3 fatty acids. Magnesium is also important because there are studies that show low magnesium is seen in chronic fatigue patients sufferers as well. So you want to take a look at your magnesium because it is important for energy, it's important for your brain overall, and also important for your emotions. So chronic fatigue syndrome and mental health is important to talk about. Experiencing chronic fatigue syndrome can alter mental health. You don't want to forget and prioritize your mental health. Along with proper diet, treating with the mental aspect of this chronic fatigue is also important. So here are some strategies that may help. You want to find ways to relax and lower stress, because studies have shown that relaxation techniques especially are very beneficial. Deep breathing, meditation, qigong, and yoga will help you to relax and manage stress. The stress tends to worsen with chronic fatigue syndrome, and it's really important to lower that stress. Next, move your body. Exercise has been shown help to improve fatigue, mental clarity, and depression. Among chronic fatigue syndrome, it's important to listen to your body and not overdo it, because overdoing can actually make your symptoms much worse. So you don't want to run a marathon, you just want to get moving and you want to get walking. That's probably the best thing you can do. And then, of course, establish a good sleep hygiene. You want to go to bed on time, you want to be consistent about your sleep, and you want to have your room to be nice and cool as well. Turn off all the electronics, put your phone away. There should be nothing in the room that has any kind of blue light. Next, I think it's really important for talk therapy. You want to talk to a counselor, a licensed therapist, about how chronic fatigue syndrome has affected you in your daily life and your relationships. You don't have to do this alone. That's really important. Chronic fatigue syndrome can be challenging both physically and mentally. However, there are numerous ways to treat symptoms and improve your energy levels. Reducing stress and eating a proper diet are two major ones. Many people also benefit from working closely with a healthcare practitioner to guide them along the way and help them feel better. Now, if you're living with chronic fatigue syndrome, reach out to create a treatment plan that meets your unique needs. The time to revive your energy levels and take charge of your life is now. I hope this was helpful for you. Stay healthy and strong. If you have any questions, please reach out. I look forward to speaking with you. Take care.